Please note that for the purpose of demonstrating this video, the therapist is shown standing on the opposite side of the client. For better body mechanics, the therapist would normally stand on the same side of the client. The quadratus femoris is another of the deep 6 lateral rotators of the thigh at the hip joint and is the most inferior one of the 6. To locate it, we first need to find the ischial tuberosity. This is the apex or distal end. From here, we need to palpate over to the lateral side of the ischial tuberosity, which is approximately here. This is the medial attachment of the quadratus femoris. From here, it runs nearly perfectly horizontally to attach onto the femur at a landmark that runs between the greater trochanter of the femur and the lesser trochanter, which is located deeper here. This landmark is called the intertrochanteric crest. We place our palpating thumb just lateral to the lateral border of the ischial tuberosity. We bring the client's leg to approximately 90 degrees of flexion at the knee joint. This motion of the thigh with the foot going toward the medial side is lateral rotation of the thigh at the hip joint. We ask the client to gently press against our resistance, trying to laterally rotate the thigh, and we palpate perpendicularly across the quadratus femoris. Be aware that the sciatic nerve travels down this area between the ischial tuberosity and the intertrochanteric crest. So if the client feels any shooting pain down into the lower extremity, we need to move off the sciatic nerve. We continue palpating the quadratus femoris laterally toward the femoral attachment as the client alternately contracts and relaxes the muscle. We can now feel the femoral attachment here. To trace the quadratus femoris, we trace it from the lateral surface of the ischial tuberosity over to the intertrochanteric crest of the femur.